So with FAI or hip impingement, we see lots of complications. One that's pretty common is called subspine impingement. So the subspine is basically the spine or scapula. Just below it, you get this sort of bony growth here. So what's going on there? If you've got an attachment point for your rectus femoris, one of your quad muscles, it starts here and goes all the way down to here. If you've ever heard of Osgood-Schlatter's disease, basically what happens as an adolescent grows, the bone can't keep up with the muscle growth. Or sorry, reverse that, the muscle doesn't keep up with the bone growth. And then it gets too tight here, it starts to pull away or avulse the bone, that causes chronic inflammation. Well, so the theory goes, the same thing can happen here. And so this is what we'll tend to see in hip impingement if you've got the subspine impingement along with it. As you bring the hip up into flexion, bend your knee, it's going to not feel good here, and the patient's going to rotate out to get away from the pain. So you get that hip external rotation and flexion. So that's a classic sign of it. Another thing, bend your knees. All right, if they were to do a short arc quad and that elicits pain, that's another sign, okay? Or, put that leg down, go and do a straight leg raise, and they get pain there when doing the straight leg raise. If you have all three of those, a pretty good indication, you can put your leg down, that you have a subspinal impingement.